name is Kaylin. I'm a junior nursing student here at Ball State. I'm going to be doing a general health history. Do you have any questions or need anything before we start?
No.
Okay, so we're going to start out with some biographical data. So can you tell me your age?
17.
Okay, your birthday?
November 19th, 2002.
Okay, and where were you born at?
Columbus, Indiana.
Okay. And what gender do you identify with?
Female.
Okay. Your marital status?
Single.
Your race or ethnic origin?
White.
Okay. And what's your occupation?
I don't have one. I'm a student.
Just a student? Okay. All right. And what's the major health issue or concern that brings you in today?
None. I'm just here for a health assessment.
Okay. And then how do you feel about going to the doctors or going to a healthcare provider?
I feel pretty normal, pretty relaxed when I go.
Okay, no anxiety with it?
No.
Okay. All right, so now we're going to talk about your present health. So how would you say you feel overall about your health?
Pretty good.
Pretty good. All right, have you had any recent weight gain or weight loss?
No.
All right, any issues or feelings of fatigue or weakness?
No.
Okay. Let's see. And then, are you having any pain today?
No.
Okay, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, where's your pain at?
0.
Okay. Now we're gonna go and talk about your past health history. So did you have any childhood illnesses growing up?
No.
None? Okay. And then when it comes to immunizations or vaccinations, do you know when you got your last flu shot?
I don't remember exactly when I got it, but I've gotten flu shots before. I get them every now and then.
Okay, but it's not consistent?
No.
Okay. And then do you know when or if you've gotten an HPV vaccination?
Yes.
Do you know when?
I actually got that one, I believe, last year.
Okay. Okay. What about hepatitis A and B?
Yeah.
Do you know when?
I don't remember exactly when I got those. Those might have been last year too.
Okay. All right. What about a Tdap?
I don't know. I don't think I've got that.
Okay. Or a chickenpox vaccination?
No.
Okay. Any adult illnesses? Asthma, depression, diabetes, hypertension, anything like that?
No.
Okay. Have you ever had any surgeries?
No. I had a biopsy done.
Okay. All right. Where was your biopsy located?
In Columbus, Indiana.
Okay. And what was the purpose of the biopsy?
To check a lump in my breast.
Okay. And when was that?
That was just last month.
Okay. All right. Any accidents or injuries?
No.
No car accidents or sports injuries?
No.
Okay. Any prolonged pain or chronic pain that you deal with?
No.
Okay. Any allergies to medications, foods, or anything in the environment?
No.
Okay. And then, are you currently on any medications?
No. Birth control.
Do you know the name of it?
It's Ovulate, I believe.
Okay. And do you know how much you take, like a dosage?
I take 1 pill a day.
Okay. And then you take that by mouth.
Mm-hmm.
You take it every day?
Yes.
When was your last dose?
Today.
Okay.
This morning, I guess.
All right, and do you know of any side effects, or you experience any side effects from that medication?
No.
Okay. All right, so now we're going to talk about the family history. First, we're going to talk about family on your dad's side. So, our grandparents, any health concerns with them?
No.
Any health concerns with your father?
No.
Any known allergies with any of them?
No.
Okay. And then on your mom's side, grandparents?
No health issues.
Okay. What about your mom?
No.
Okay. Any known allergies?
No.
Okay. Do you have any siblings?
Yes, I have 2 younger brothers and a younger sister.
Okay. How old are they?
My brothers are 9 and my sister is 10.
And their health, is it generally healthy, would you say?
Yes.
Any allergies?
No.
Okay. All right, so now we're just gonna go through some different body systems and talk about those, and any health concerns that could be related. Any issues with skin, hair, or nails, like skin disease, changes in moles or freckles, dry or moist skin, itchy patches, anything like that?
No.
How much sun exposure would you say you get?
In the summer a lot. I mean, I guess I get outside every day, so.
Mm-hmm. Okay. Do you maintain well-groomed skin?
Yes.
Okay. Now we're going to talk about the head and neck. Do you feel or experience frequent or unusual headaches?
No.
Any feelings of being dizzy or going to pass out or being kind of spinning feeling?
No.
Okay. And move to the eyes. Any difficulties with visions? I see you have contact or glasses, so do you have contacts as well?
Yes.
Okay.
But no difficulties.
Okay. Any eye pain or redness or swelling or drainage?
No.
Okay. And when was your last vision check?
It would have been in August of 2020.
Okay. And then we'll move to ears. Do you experience frequent earaches, ear infections, or redness, swelling, or drainage of the ears?
No.
Okay. How do you clean your ears?
With Q-tips.
And how often do you do that?
Usually every day or every other day.
Okay. And now we're going to talk about mouth, nose, throat, and sinuses. So when it comes to the mouth, do you experience toothaches, discharge, any change in taste?
No.
Nope. Do you have any bleeding or retraction of the gums?
No.
Do you have any bleeding when brushing teeth?
No.
Okay. How often do you brush your teeth?
Twice a day.
Okay. And when was your last dentist appointment?
That would have been in June 2020.
Okay. And then with the throat, do you experience any discharge, sore throats, difficulty swallowing, changes of voice or taste, or anything like that?
No.
Nope. Okay. When it comes to your nose and sinuses, do you have any discharge, frequent or severe colds, nosebleeds, any changes in smell?
No.
Nope. Okay. We're gonna move to the thorax and lungs, the chest and lungs now. Do you feel chest pain often or at all?
No.
All right. Any history of lung disease
No.
or shortness of breath,
No.
wheezing?
No.
Do you experience persistent coughs or excessive mucus?
No.
Okay. And then are there any toxins in your home or school environment?
No.
Okay. So now we're going to move to head and neck, the vessels of the head and neck. So you said no chest pain. Do you ever feel any pressure in the chest cavity?
No.
Okay. Have you ever experienced heart palpitations or difficulty breathing with movement?
No.
Okay. And then have you ever been diagnosed with a heart murmur, hypertension, anemia?
No.
And do you have any abnormal swelling?
No.
Okay. Do you ever wake up in the middle of the night and not be able to breathe?
No.
Okay. So now we're going to talk about the peripheral vascular, so the vessels of the rest of the body. Do you ever feel abnormally cold or get a feeling of being tingly or cramping?
No.
Okay, any swelling or discoloration?
No.
Okay. So now we're going to talk about the abdomen. Have you had any changes in appetite?
No.
Any food intolerances?
No.
Okay. Any abdominal pain, indigestion, nausea or vomiting?
No.
Okay. Do you ever have heartburn?
No.
Have you ever had any issues with the liver, the gallbladder, pancreas, or appendix?
No.
Okay. Any issues? Any issues with defecation, any constipation, diarrhea, bleeding?
No.
Okay. And when was your last bowel movement?
This morning.
All right. And how often would you say that those are?
Once or twice a day.
Okay. Okay. Now we're going to talk about the musculoskeletal system. Oh, do you ever need to take laxatives or antacids?
No.
No? Okay. In the musculoskeletal system, do you have any history of arthritis or gout?
No.
Okay. Do you have any issues with any of your joints or any back pain or history of back problems?
No.
Okay. Do you ever get muscle cramps?
No.
Okay. Now we're going to talk about the neurological system. Do you ever experience fainting or blacking out?
No.
Any history of seizure disorders?
No.
Any movement issues, numbness or tingling?
No.
Do you have any issues remembering anything?
No.
Okay. Do you have any history of depression?
No.
And do you experience any anxiety?
No.
Okay. Do you have any hallucinations or other mental health issues?
No.
Okay. All right, so now we're going to kind of talk about your lifestyle and your health practices. So can you describe what a typical day is like for you?
I usually wake up, get something to eat, and then I'll work on schoolwork for a while, depending on how much I have. And then after that, I'll usually eat dinner, and then I'll take some time in the evening to just kind of chill and relax, and then I'll go to bed.
Okay. And then when it comes to your weight, are you happy with the weight you are right now?
Yes.
Do you eat a balanced diet?
Yes.
Okay. Do you eat any junk food? If so, how often?
I eat a little bit of junk food.
Okay.
Maybe like once a week, twice a week.
Okay. And then do you ever eat out?
Yeah, maybe like once a week.
Okay. All right. And then when it comes to activity and exercise, what do you like to do?
I like to walk, and I also like to lift weights.
Okay. Do you stretch often?
No, not really.
Okay. When it comes to sleep, how many hours of sleep would you say you get at night?
Around 8 or 9 hours.
Okay. Do you ever take naps?
Maybe once a week.
Okay. How long do you think that lasts?
About an hour and a half.
Okay. All right. Do you have any issues with self-esteem?
No.
Are you able to regularly maintain self-care?
Yes.
Okay. What kind of social activities do you like to do?
I like to hang out with my friends often.
Okay. How often would you say?
About every day.
Okay. And then tell me about your relationships.
My relationships with my friends are good, and as well as my boyfriend and my family and my siblings, so.
Okay. How often do you see your friends?
Every day.
And then how often do you see like your family?
About once every 3 weeks.
Okay. And then would you describe those relationships as positive?
Yes.
All right. When it comes to your values and belief system, would you say, do you identify with any sort of religion?
Christianity.
Okay. Any sort of denomination?
Baptism.
Okay. And then would you say that your religion plays a large role in your life?
No.
Okay. When it comes to education and work, you said you are a student. Where are you a student?
Ball State University.
Okay, what year?
Freshman.
And you said you're not currently working, right?
No, not currently.
Okay. Okay. Do you ever experience stress?
Maybe sometimes.
All right. Do you know what kind of situations kind of encourage that?
Usually when I have like a lot of work to do, a lot of schoolwork.
Okay. And then how do you cope with that stress?
I usually do the schoolwork.
Do the schoolwork? Okay. And then when you describe your environment, would you say you feel safe and relaxed?
Yes.
Okay. Do you have adequate heating and cooling and other utilities in your environment, your home?
Yes.
Okay. Do you have access to transportation?
Yes.
And would you say that there's any hazards in the home?
No.
Okay. Let me just look over and make sure got everything. Do you have any questions or concerns
No.
for me?
No.
Okay. Well, it looks like we're all done. Thank you for being my patient.
Thank you.